certainly an emerging area in prostate cancer, although we are not routinely using circulating biomarkers in clinical care. I think that sort of with advances in technology, the ability to sample cells, blood, DNA that's in circulation are all going to be integrated into routine care over the coming months and years. Right now, one of the main questions is when a drug stops working, why does it stop working? Can you figure out, obviously, who's going to benefit and who's not going to benefit? Particularly when looking at some of the hormonal therapies, one of the main questions is, are there certain predictors of response where you could sample it, beforehand? Really, the first use of circulating biomarkers in prostate cancer was just to understand sort of, what we call, prognostic factors. If somebody has a lot of circulating tumor cells, and that seems to be, unfortunately, very, a rather poor prognosis factor. Obviously, we try to give medicines to make that better. Conversely, what's been shown is that if you can then decrease the number of circulating tumor cells that in the circulation, patients who respond well and have a decrease, they seem to do better, and therefore it's sort of an early indicator of having a good response to treatment. People have looked to see if these markers add anything to sort of traditional markers like CAT scans, PSA, and they do, which is very exciting. But that's really focusing mainly on just counting the number of cells. And these are papers that now go back a few years. Some of the newer technology is really moving even beyond that and looking at specific characteristics of the DNA in circulation.